Hi, you guys. It's Suzy from Empty Nest Blessed, and I am here with my friend, Dr. Lori Stetler from the Dallas Center of Dermatology and Aesthetics. And today I am here to tackle all of your questions about necks. All of us in our 50s have this angst about our necks. I hear that from you guys all the time. So I wanted to go straight to the source and talk to a dermatologist about all of the range of things we can do for necks, why necks are so difficult, etc. And as you can see, I'm getting numb right now for a procedure that she is going to do on me, hopefully for my saggy neck. Okay, Dr. Stetler, thank you for joining me.
You're welcome.
Let's talk about why are necks so difficult.
Okay. Probably the biggest reason necks are difficult is the skin is thinner. It's not quite as resilient as, say, facial skin. We can't get away with as much on a neck as we can on a face because of that thinness, right? We're worried about scarring, we're worried about texture change, so it's just a little bit trickier area. The neck also gets a ton of sun damage, and so over time we get breakdown of collagen and elastic tissue, making it also just a little more challenging area to treat.
Okay, I thought the neck skin was actually thicker because I was thinking it was like an elephant. I mean, it's kind of wrinkly.
Not at all.
And it feels kind of coarse,
right.
But it's actually thinner.
It's thinner.
Okay.
And a lot of what you feel are just because the top layer of skin thins, you just feel little glands and little texture changes underneath.
Okay. Okay, so when it comes to the issues that women over 50 have with their necks, what is the range of things we can do? So I've heard people frustrated with everything from double chins to crepey skin,
right,
age spots, and of course sagging,
right,
which is my complaint.
And then the other is discoloration
yes.
and sun damage.
Yes.
So you can approach it a lot of different ways.
Okay.
So early on, so sunscreen goes without saying, and that is one area I think we neglect, in general. So don't just do your face, extend it all the way down, and especially if you wear lots of V-neck type tops,
yes,
extend it down to your chest too, because these don't respond as well to sun damage. You can start with topical products. There are some topical products that help. There is no neck lift in a jar, so it's not going to replace some of the things we're going to talk about and do today. Two of my favorites are one called Neck Correct Cream by Skin Medica. There's another one called Nectifirm. Those are probably two of the ones. Those contain growth factors and peptides. Basically, as we age and we don't make as much collagen, anything we can do to boost collagen levels help, and so that's where those are targeted. Some people can use retinoids on their neck. That area, because it's thin and a little more sensitive, will often get redness, itchiness, rashiness. So some people can tolerate it, some people can't. Okay, so that's products. Then we move on to procedures, depending on what we're doing. So today we're addressing crepey skin and skin tightening. And so we're gonna do Scarlet, which is a radio frequency microneedling device. Other things you can do, Fraxel, those devices you can do on the neck and chest for texture, crepiness, brown discoloration. Those can help. Those are lasers, okay. Right? And then you can also do thermage for tightening. When you're talking fat under here, that's a whole different ballgame in terms of other things we can do. There's a treatment called Kybella for fat reduction. You can do cool sculpting. Obviously, plastic surgery is another thing that we use for different, issues related to the neck as well.
Okay. Our necks, is it just me? Is it just us? Or is that a common question that you get throughout the day?
All day long.
All day
and
long.
It's one of the hardest ones, and I can't stand myself with that. So I'm right here with you.
Yes. Yeah. Okay. All right. That is great. So let's talk a little bit specifically about Scarlet and what we're doing today and why I'm getting numb.
Okay. So Scarlet, a newer device in our world, probably been out about 3 years. We've been doing it for about a year. So it's a combination of radio frequency and microneedling. So what that means to us, microneedling, when we puncture the skin with little microneedles, results in collagen production. And these needles are insulated and they have radio frequencies, so you get tightening. So it's great for crepey skin, great for stimulating collagen, and we can use it everywhere. So you can use it on face, you can use it on necks, chest, crepey arms, backs of hands. So it's got a wide utility of things that we use. And it's usually done as a series of treatments. Most people typically do 3 treatments. Having said that, older patients, they say basically 1 per decade. So say if you're 60, you might need 6 treatments. So because it's gonna take a little longer because the skin's gonna probably have more crepiness, more loose. it'll take more to get the desired result.
And how long does it last?
So you make collagen. So the good news is anything we can do to make collagen kind of turns the clock back, right? Now we are going to break it down as we get older or as we age along, but think of it just as kind of turning back time just a little bit. Okay. It does take, so treatments are done on 4 to 6 week intervals. You don't always see clinical improvement for several months after treatment because it takes our body's time to make collagen. Healing time relatively quick. So you'll see on you today, when you leave, you're going to be red, welpy, almost like little mosquito bites kind of all over, or a little bit of a sunburn. By tomorrow you'll be pink. After that you're going to be kind of pink and dry. I felt kind of itchy after one treatment, just kind of like, oh. And you just hydrate and keep moisturizer on it, and we'll go over post-care instructions with you. And then obviously sun avoidance is key as well.
Okay, so obviously the in-office treatment is going to be the absolute maximum that we can do.
Right.
But what can people do at home then to support a treatment that you do maybe in the office, whether it's this or one of the lasers or something like that?
So again, sometimes we'll prep the skin for different things if we're going to do a treatment. Afterwards, we use a treatment cream called elastin, which helps promote collagen and elastin formation. So we'll have you do that after the treatment, in addition to the sun protection. And then the nice thing about this is if you like it and you're successful with it, you can do maintenance afterwards. So you may say, you know what, I've done my series of 3, but maybe once a year I'm going to go in and do a repeat maintenance treatment to keep that collagen forming. If you in addition have redness, brown spots, there are other laser things that we can do to just blend the whole area.
So what do you think about at-home devices, the microneedling, the electro?
So I think the microneedling is safe. It's very shallow, so you can't make a huge impact like you can on a device that we can use in our office. So I don't think they're going to really hurt anything as a general rule, but they're not super helpful. The electromagnetic devices, there are a lot of things that stimulate muscle. The problem with that is if you have wrinkles that are caused by muscle action, say crow's feet, frown lines, you can make those worse. So some of that stuff is kind of gimmicky. And so obviously medicine, we're based on science, and so we're always looking for more scientific treatments.
That's great. Okay, last question. With the neck, there's also that décolletage area. I don't have much of that.
You don't. Yeah, you don't.
But should people extend neck treatment down there? And often when you do things in office, do you extend down to that area?
So, and obviously when we look, we're looking at your whole aesthetic unit, right? So, because most of the things aren't just located in one spot. So if you see that, or you see sun damage carrying all the way down, most of the time we're going to try to carry our treatments down that far. And sometimes there are treatments that potentially would leave a line of demarcation that we can't do on those patients, because what you don't want to do is clean up a face and then leave a contrast between neck and face. And so those are all things that would be addressed fully in a cosmetic consultation. We just need to see you, and a lot of these treatments are done in the fall and winter for people who do have a little more olive skin type, just for those reasons.
To stay out of the sun. Okay, that's great. Thank you. You answered all of our questions. Yay. I'm so grateful.
Let's get to it.
Let's get going.
All right.